If you're an occupational therapist, physical therapist, or a speech therapist, and you're deciding if travel is for you in comparison to a staff position, this is the video for you. Hi everyone, welcome back to my channel. If you're new here, I'm Sheila and I'm a travel occupational therapist and certified hand therapist. Experience in clinical practice as a hand therapist. I've worked in acute care, I've done some teaching, and most recently I've been doing travel contracts. And if you're deciding if travel is right for you, stick around for this video. Today I share an honest comparison and things I wish I knew before I made the switch. Possibly staying staff is the right fit for you. So one, let's talk about the realities of travel therapy. There are some pros and cons that I share in this video here, but just real quick, usually there is higher pay depending on the setting that you're in. Thanks to the stipends and tax advantages, you might find that your take-home pay is higher, you're paid weekly. You can take off months or even weeks between contracts, so there is a lot of flexibility in travel. If you're looking for adventure and variety, definitely travel is the way to go. And you can find that there's rapid skill growth. So even as myself, I started traveling probably about 6 or so years into my career, and I worked alongside really experienced therapists within my travel. So I really feel like it helped me really grow my skills to become a better clinician in a very quick time. But of course, with travel, there are stresses. So there's constant onboarding stress because typically contracts are 13 weeks in length. So you're constantly working in new environments, getting adjusted to new workflows, meeting new coworkers, and probably orienting to a new EMR system. Oftentimes, another con can be finding housing. I also share that in this video. Finding housing is by far, to me, the most stressful part about travel, and having to pick up and move constantly can absolutely be fatiguing. Third, you're always the traveler. There's not really any continuity, which can be kind of challenging, but the caveat is that that could be nice, that could be exciting. 4, another con of travel is that there are very high expectations. The expectation is that once you come in as a traveler, for the most part, you're expected to get up and running almost immediately. So there's a lot of expectations. Sometimes productivity expectations can be very high as a traveler. And the 5th con is that it can be loneliness on the road. If you're someone who can easily go out and meet people, you'll probably have an easier time with this, but there will absolutely be times where you're away from family and friends, and sometimes that can take a toll on you. And I will also add that starting over and meeting new people can sometimes be socially draining. Just to give you some background, I was staff for about 6 years before I started traveling, and in my role prior to me becoming a traveler, I was a senior occupational therapist. Some pros of being a staff therapist, of course, is the stability. For the most part, you're going to have a consistent schedule, you'll have long-term routines, and a steady paycheck, which is pretty nice. I know even for myself, especially during my time as a senior occupational therapist, I was able to switch my schedule up so that I can be an adjunct professor on the side. And that was something that I really wanted to pursue. And truthfully, being stationary certainly lends itself to being able to pursue those opportunities. I know there are some schools that have remote options because I have some colleagues and friends who have been able to do virtual learning, but for the most part, you become more attractive if you're stable. Next up is benefits. So we're talking dental, vision, and all that good stuff. Definitely, it's easier and for continuity's sake if you are stationary. Also, if you participate in your company's 401 plan or 401k or their retirement plans, all of these things, becomes a bit more tricky as a traveler. Those type of benefits are so much easier to navigate when you're a staff therapist. One thing that I do miss about being a staff member is that you get really good continuing education benefits depending on your company. There is some continuing education support that is provided as a traveler through my agency, but it is nowhere near as robust as I was receiving as a staff therapist. So that's something to consider. I feel like especially earlier in your career or even earlier in my career, I was taking continuing education classes at least once or twice a year. And it was great because none of that was coming out of pocket. Now that I'm a little further out, I'm a bit more selective of the continuing education courses that I pursue. However, now that's coming out of my own pocket for the most part. And I just was up for renewal so I had no choice but to go through with my continuing ed. And that was a lot of money out of pocket. So especially if you work for an employer that provides a lot of continuing education support, that is absolutely a benefit of staying staff. So another pro of being a staff therapist is that, especially in outpatient hands, I work very closely with the surgeons, and over a period of time, you have that trust with patients, staff, and with surgeons, and that comes with time. So that's something that, in terms of those meaningful connections amongst the team, that definitely happens more so when you're in a staff position. When I look back at my career, I was able to roll out programs within clinics. I was able to really get engaged in PI initiatives within the clinic and quality improvement and just different things around the clinic. And that was a season of my career where I really don't take those opportunities for granted. And it's easier to do those things when you're in a staff position. Because as a traveler, the expectation is that you're coming in, you're seeing your patients and going home. But if you're someone that really wants to be involved in different initiatives and things within the clinic, most likely a staff position is going to be in your best benefit. There were other programs that I was supporting, and there hasn't really been many opportunities for that as a traveler. So if that's something that's important to you, definitely consider staying or getting a staff position. It's not impossible, because I've still been able to be involved in those type of initiatives, even as a traveler, but they're very few and far between. And when we think about what's next for my career, I guess I'll talk about that at a later time, but I know there's been times, or I'm in a season of my career where I'm deciding what's next, and I'm very much leaning on those experiences that I have done really as a staff therapist. I know in my current contract, I'm still doing some degree of mentorship, and it's also because I've been here for almost a year now as a traveler. But in terms of supervising students, program development, and being a specialist, all of those things are so much easier to do as a staff therapist. So opportunities for leadership, especially as a staff therapist, that was when I was in a permanent role, when I've supervised students, been involved in program development and mentoring, as well as specializing. Those are all things that were easier, not impossible, but easier to do in a staff position. The cons of being in a staff position, definitely the lower pay ceiling. Depending on where you are, you have to be in a great company, really, for raise pay. It comes out in the wash, I feel, because you get the benefits, but a lot of companies don't even get great benefits. So that's something to think about. And especially as it relates to productivity expectations, they definitely don't disappear. And I feel like, honestly, the productivity expectations have been higher as a staff OT. And I feel like I had the same productivity expectations as a staff therapist. And because I believe the trend on my schedule has been that there has been such a need that there are very rarely talks of productivity. And it could be because of where I work. I only take contracts in hospital-based outpatient clinics. So I think what it is that they watch my schedule like a hawk to make sure that all of my spots are filled. And I find that there's such a need that my schedule just stays full And that has been across the board and pretty much everywhere that I've worked as a traveler so far. But I feel like as a staff therapist, I feel like you still have the same productivity expectations and for less compensation. So I know it's different if you work in a SNF, but for me personally, I have found that if I compare my experience as a traveler to when I was staff, the productivity is the same, but somehow I stay busy. I don't know. And I think this is kind of across the board, but that's one thing that I'm not looking forward to being a full-time therapist again, is the limited flexibility. I know that regardless of everywhere that I've worked, getting time off is so challenging. I was working in a clinic where you had to put in your request a year in advance, and I find that being staff offers so little flexibility. Even places that tend to be flexible just pale in comparison to the amount of flexibility that you have as a travel therapist. I have been able to request time off. Typically, when you are submitted for a job or you accept the travel position, you send your request for time off ahead of time, and I have had no problem with it being approved. But as a staff therapist, it has always been so challenging to get time off. So as a staff therapist, in comparison to travel, by far offers you incredibly more opportunities for flexibility. Because I just took a week off last week from my contract. It was at the end of the summer. I took off 3 weeks. That is unheard of in a staff position. So I've worked places where they really fight tooth and nail for you not to have time off. So staff is definitely not winning in the flexibility Olympics. Another con of working as a staff occupational therapist, in my experience, has been burnout risk. I think when I look back, I feel like even though there are things, I don't know, the politics, the unreal expectations of being a staff therapist, and all of the systemic issues, I am pretty much shielded from that as a traveler. Again, pretty much I'm being paid and expected to see my patients and go home. But as a staff therapist, it was like a double-edged sword of being involved in all of these different program development initiatives. You're just constantly just doing more. And I feel like it's probably just my personality. I don't really know. I still haven't really decided that, but I was so burnt out. I feel like even though things are different, every day is different as a therapist, but for the most part, you're seeing the same stuff all the time. And I was trying to do I wanted to be involved in different things, but there are so many changes that I felt like I could facilitate change. And it's just like, nope, we can't do that. I feel like in a staff position, the burnout risk is higher. In the clinic, there are just so many systemic issues that eventually wear on you over time. I'm still trying to figure out where I ended up on the burnout cycle, but I think because I couldn't really take time off like I wanted to, you're mentoring, you're doing all of these different things, the workload demands just continue to increase. You're not getting paid more and you're still not even able to take off time. And I just feel like the burnout risk was so much higher. And I know for travel, especially if you're doing shorter stints, like 13 weeks, I really feel like you can do anything for 13 weeks. And going to meetings and having to really advocate for the profession and your patients, that eventually wears on you over time. And I feel like I don't have to really deal with that as much as a traveler. So for the most part, I feel like I don't have the same burnout that I did as a staff therapist. And sometimes I kind of find that same burnout, but not really. And I think it's because I really just go see my patients and I go home. So I'm not constantly having to advocate for the profession. I'm not doing all of these different initiatives and being met with resistance. And after 13 weeks, you're on to the next. I don't go to staff meetings, and sometimes those the like politics of the workplace, where it just makes being in the workplace as a staff therapist so much more challenging. So for the most part, none of that really affects me because you're really in and you're out. You're seeing your patients and you're not engaged in any of the other things that make this job more challenging. So I will say that neither shields you from burnout, because all the burnout that I'm not experiencing as a traveler within the workplace, I feel like I'm just making up for that burnout in the picking up and moving and the unpredictability of it all. So I guess you're shifting from one to the other, but I definitely don't want to say that burnout, you're shielded from burnout. Because at the end of the day, this is a very challenging profession and job. And if you don't have those supports in place emotionally and mentally, regardless if you're doing travel or staff, it's going to be some degree of burnout, but that's just something that has gotten better over time. But overall, I would say as a traveler, I just tend to have less burnout. And money versus lifestyle, absolutely, travel OT can accelerate your financial goals. And I will say that staff OT offers stability. So I feel like neither addresses the biggest problem that therapists face. It just depends on where you are in your career. I know for me personally, I wanted to sit for the CHT exam, so I stayed stationary because I wanted to get my hours. And yes, I wanted to be involved in program development. I was involved in a lot of different things within my first job, and I'm grateful for that. I was involved in the ALS clinic. I was the OT on our concussion team. I was doing vision rehab. But then eventually I was like, you know what? I want to focus on hands. So it just depends on where you are in your career. And on the weekends, I used to work PRN in a hospital, so I still kept up my acute care skills. So it really ultimately comes down to what's most important to you at this current point in time. I'm at a point right now where I wanted to pursue travel because I wanted the flexibility and I wanted to see more of the country. But now I'm starting to feel like I've seen enough. At this point, I've lived in just about every major city. I've been in really challenging hand therapy clinics where I've really grown as a therapist. I feel like for the most part, my clinical reasoning and stuff, but I've been places where I'm just seeing straight hand OA and repetitive strain injuries. And I've also had some contracts where I'm working with like world-renowned surgeons at world-class hospitals where people are flying in for hand therapy. So I've been places that are very challenging, and I'm just deciding what is next for me. So am I gonna continue to travel? I don't know. Your guess is as good as mine, but I'm not gonna lie to you. I'm kind of in a season where I'm over traveling. I'm over picking up and moving all the time. So I'm just thinking I have some opportunities where I can be staff again, or I can even have I'm pretty much essentially running or responsible for the hand therapy clinic myself. I can do the staff therapist thing again. I've had students before, but I don't know, I just miss the teaching aspect. I'm somewhere right now where I've just continued to extend, but I don't know. I just have some other life priorities and goals right now that I'm like, I don't know where else I need to live. At this point, I've lived in the San Francisco Bay Area. I'm now in Los Angeles. I've lived in New York, Boston. I'm from DC. I've literally lived everywhere that is a major city. Also San Diego. I don't know. There are some differences in cities, but I don't know. A city's a city, you know what I'm saying? So I just have some other things I want to do in my life personally. Am I still gonna travel? Am I pivoting out of clinical work? I don't know, that's been something I've wanted to do as well. So we will see. But I feel like the biggest question that many therapists face is, do I want to do direct patient care for the career? So do I want to do patient care for the rest of my career? So that's where I'm at right now. I traveled just because I wanted the flexibility to be like, maybe I don't want to work for a month. Maybe I want to live in different parts of the city. I wanted to live in different parts of the country. I always wanted to live in San Diego. And I did that for 3 months. So I'm kind of just like, there's other goals that I want to achieve that require me to be somewhere stationary. So it may not be tomorrow that I'm pivoting out, but we'll see. My patients here like me. It's pretty chill work. I like the people I work with. And they're like, we can just continue to extend you. So they really like me. And I like it here. I like LA. I'm making friends here. But do I still want to do patient care, direct patient care? I don't know. So those are some questions that I have. And when I think about it, I've been doing this for years now. So there's just a lot of things that I'm considering. So I hope this video has been helpful for you if you are deciding to do travel, to stay in a staff role, or maybe even pivot back into a staff role. I would love to know, when did you decide it was time? Because I'm starting to feel like it's time. Like, money is cool, but I'm starting to be like, aside from the flexibility and the weekly pay is nice, I'm just kind of like, do I just continue to do this? I'm grateful that I have options. I had someone from years back call me recently. Oh, we're gonna expand a clinic out on the West Coast. If you want to, we're looking for a clinic director, and there's different opportunities back in the DC area. So I'm just thinking of these pros and cons of staying a traveler, or possibly pivoting back to staff, or possibly leaving patient care altogether. I don't know, that's on the table as well. But hopefully this video was helpful for you if you're still contemplating to potentially pivot to travel, or maybe even stay in your staff position. Let me know in the comments, and catch you in the next video. Bye.